Hi, I'm Dr. Bhavesh Gupta, hair transplant surgeon practicing in Kharghar area of Navi Mumbai. Our website is www.transplantmaster.com. Please like and follow our channel. Today we will be speaking about the use of beard grafts in hair transplant. We encounter a lot of patients who are suffering from grade 6 and grade 7 alopecia, and they want to get a full hair restoration, full coverage done by hair restoration. But the problem which we frequently encounter is the less number of donor area available, or the less number of donor graft available. What happens in grade 6 and grade 7 alopecia is the donor area from the back of the scalp and from the side of the scalp, they are sparse in number and they are thin in quality as compared to normal patients or grade 1 or grade 2 alopecia. So what we will have to do is, in such cases, what happens is, if we harvest the grafts only from scalp area, we will frequently be short of grafts and we won't be able to cover the head from start to the crown area completely. So in such cases, we try to use the hair graft from the other body areas like beard and chest. Through lot of evidences in the literature, we have come to know that beard and the chest area are the areas which can give us good amount of grafts if there are robust hairs present in the beard and chest area. And even out of beard and chest, beard is always preferable as compared to chest, as the hair growth and the quality of hair present in the beard area is thick and more coarse as compared to the hairs present in the chest area. So now we are coming to the benefits of using beard grafts in hair restoration. The first benefit being, we can easily harvest 3000 to 4000 beard grafts if the patient has a very good beard growth. The second benefit of using a beard graft is the texture and the coarseness of beard hairs are comparatively better as compared to the thickness or the coarseness of the scalp hair. So it helps us in giving good amount of density, and it helps us it acts as a filler in the hair restoration procedure if used properly. The third most important benefit of using beard graft is the anagen phase or the growth phase of beard graft is comparatively shorter as compared to the growth phase of scalp. So the beard graft grows at a good pace as compared to scalp graft or chest graft if you compare. That is why post transplant we see a better hair growth and a faster hair growth with beard graft as compared to your chest graft. Now we'll come to the technique of using beard grafts. While harvesting grafts from beard, we preferably use 0.7 mm cold punch or ulti type punch. 0.7 mm means it is approximately 0.3 mm less from a normal 1 mm size. Okay, so the scar which is left behind after removing beard graft is very minimal, and in a patient's day-to-day life, nobody will be able to make out that we have harvested so many grafts from beard. We will show you our cases wherein we have harvested approximately 2000, 2500 and 3000 grafts from beard, and the scar is minimally or not visible at all in those cases. Coming to the results, soon after this video you will see cases in which the patient had grade 6 and grade 7 alopecia, and the donor area was not sufficient for us to go to the beard and remove some grafts. So we have removed graft from beard and added to the scalp graft while implanting, and these are the results after surgeries. So now we will see the grafts what we harvest from the beard, how are they distributed. So suppose if this is a grade 6 or grade 7 alopecia case, wherein we can harvest maximum 300 to 3500 grafts from the scalp, and if the patient has a very good beard, we can possibly harvest 3000 to 4000 grafts from the beard area. How do we distribute it? So on the day 1 of transplant, we cover the hairline area and the frontal tuft area. In this area, only and only scalp grafts are used. We don't use beard grafts in that area, because beard grafts are possibly thicker and more denser and coarser in nature, which will not appear very natural if it is used on the anterior region of the scalp. On day 2, we try to cover the anterior mid-scalp area and the posterior mid-scalp area. In this area, what we do is we harvest some grafts from the scalp and we implant it, leaving some gaps. These are the scalp grafts harvested from the donor area and implanted in the anterior and posterior mid-scalp area with the gaps left. And then we go ahead and harvest some grafts from the beard as well and fill up those gaps with the beard hairs or beard grafts. This makes sure these are randomly distributed. So in the anterior and posterior mid-scalp area, A combination of scalp plus beard grafts are implanted in such a way that after transplant it appears completely natural and nobody will be able to make out from where we have harvested the graft and where we have implanted the beard grafts. So this combination of scalp graft and beard grafts are done on the day 2 of our surgery. Suppose if the patient requires a day 3 of transplant. Day 3 normally we do for the crown area and for the area around the crown region. So in the crown area we possibly try not to use any kind of beard graft, which again gives a not so natural appearance after transplant. If there is a requirement of beard graft on day 3, we try to use in the paracrown or parietal region, this area. You can call this area as parietal area, and we try to use the beard graft along with the combination of scalp graft in the parietal area but not in the crown area. So in conclusion, we use beard graft area only in the anterior midscalp area, posterior midscalp area and required in the parietal area, but we never use beard grafts in the hairline region, in the frontal tuft area, in the crown area as well as not in the temporal area. Thanks again. This is Dr. Bhavesh Gupta from Hair Restoration Clinic, the benchmark for hair transplants.